Chapter 5 will finish the endocrine section by looking at drugs used really in osteoporosis but also in Paget's disease, so for bone and mineral disorders. The actual primary drugs to know here are the bisphosphonates. And bisphosphonates are drugs that have established use in Paget's disease. But you know, between you and I, unless you live in Eastern Europe, you're not going to see many Paget's disease patients, are you? So obviously there's been a remarketing of bisphosphonates in the past several years for postmenopausal osteoporosis. Now certainly far more common than Paget's disease. It does work in Paget's disease. Remember, Paget's disease is that weird disease of bone remodeling whereby there are phases of osteoclastic and osteoblastic activity, and as the patient goes through these phases, the patient remakes a bone that is not a nice lamellar woven type of tissue, but rather what we call a mosaic pattern. This makes it a fragile bone. Characteristic vignette here before they ask you about the drug would be someone whose head is enlarging and they can't fit their hats anymore. So that like this, you think, oh, maybe it's Paget's disease. Then if you touch the bone that is affected, you would feel that the bone is very warm because of high vascularization of this bone tissue. This can actually result in high output cardiac failure. Also, never forget that Paget's disease can be a nice stem to test you on the potential risk down the road, although small, but here nonetheless, of developing a malignancy of the bone. And the most common primary tumor of a bone in the adult is osteosarcoma. You are correct. So the bisphosphonates, how do they work? Well, what they do is stabilize the actual matrix of the bone, which is hydroxyapatite. If you remember, hydroxyapatite is the matrix into which the osteoblast will allow the deposition of minerals. And by stabilizing hydroxyapatite bone structure, it happens that these drugs induce osteoblasts to secrete inhibitors of osteoclasts, the multinucleated giant cell that break the bone, and by inhibiting osteoclastic activity, prevent bone resorption. From there to say it decreases progression of osteoporosis is a big step, obviously, since osteoporosis, remember, is not a problem with bone breakdown, but rather with bone turnover slowing down. Never forget the urine of a patient with osteoporosis has normal calcium, normal phosphate, normal alkaline phosphatase activity. This is not osteomalacia. So what are bisphosphonates? They all end up in nate. So if you see alendronate, if you see pamidronate or etidronate, so if you want to write them, pamidronate, etidronate, all these are very classic bisphosphonates. They're considered now drug of choice, particularly when steroids are inducing osteoporosis. And here's my biggest worry. My biggest worry is if I induced osteoblastic activity, there's a good reason why I talk to you about osteosarcoma. What is an osteosarcoma? It is a tumor of osteoblasts. And what I would worry about these drugs is that in the long term, they might be shown as increasing the risk of osteosarcoma. As a matter of fact, notice how we use these drugs in osteoporosis. It literally went from just about once a day a few years ago to once a month, once a year. I mean, eventually it looks like we're going to use a bisphosphonate at birth and then treat osteoporosis by the end of it. So make sure you know this is the drug for Paget's disease, but they're also currently known as drugs for osteoporosis.